This is a video on HPV testing for the medical provider, geared to educate physicians for use in their clinical practice. High-risk HPV testing is any test where the positive result indicates the presence of one or more high-risk HPV subtypes. HPV infects the cervical transition zone and causes cellular changes that can eventually progress to dysplasia and cancer.
A pap smear is a simple office-based procedure in which a speculum is inserted into the vagina and a swab is used to collect a sample of cells from the cervix.
HPV testing may be used as part of primary screening for cervical cancer, usually as a co-test with cytology or for reflex testing after an abnormal cervical cytology result, for example with ASCUS. Currently, 5 tests are approved by the FDA for co-testing for HPV. These are listed below. The COBUS HPV test differs in that it specifically identifies types 16 and 18 and pools results for 12 other types, and is the only HPV test specifically approved for primary screening rather than for co-testing. Specimens for HPV testing can be collected from the endocervix using a spatula or cervical brush, which is then placed in HPV transport medium. This diagrams the process from sample collection to DNA isolation to analysis for the COBUS test. COBUS test is the only approved test for primary screening, in addition to being available for co-testing and reflex testing. Compared to prior standards, the COBUS test had similar sensitivity and specificity for the diagnosis of HPV. Additionally, it provided more clarity on the presence or absence of HPV 16 and 18. Laboratory cytotechnicians are trained to validate each slide for quality of the sample in less than optimal preparations. In order to order the test on Cerner, search for PAP and then click HPV probe thin prep for the pap smear and HPV DNA probe for the high-risk reflex HPV test. A pelvic exam and pap smear costs $319 in the US. The HPV test is free for women who have had treatment for a high-grade abnormality and are having the test to determine if they can return to twice-yearly screening.
Pap smears are conducted in conjunction with HPV testing during co-testing. The following are the different types of pap smear results: ASCUS, LSIL, HSIL, ASCH, and AGC. We will be focusing on HSIL and ASCUS. For HSIL, regardless of age and HPV status, follow-up requires colposcopy. For ASCUS, follow-up testing is dependent on age and HPV status. Please refer to the table for preferred testing.